Let's talk about cranial nerve 7 and a facial droop. Sometimes our patients will have facial droops, difficulty closing the lips after surgery. I discuss with my surgeons and find out what is the reason for the facial droop. When you work with head and neck cancer, the reason can be a modality of differences. Perhaps the tumor involved a branch of the facial nerve in which the surgeon needed to remove the cancer to help the patient be here, to improve their best quality of life and be cancer-free. Perhaps the surgeon needed to sever the nerve, or the nerve was already severed by the tumor, to be able to also remove that cancer. So sometimes our patients are really frustrated and upset after their surgery, and that's understandable. They didn't fully understand or grasp the deficits that would remain. So what do we as the therapists tell them? Number one, I'm always on the same page with my surgeons. I try my best to understand what that patient's expectations are from the surgical outcomes. Number two, I remind my patients that we have quality of life and that we are going to make the best of the muscles and whatever the nerves will allow those muscles to do. And number three, I ask my surgeons if they're expecting some recovery over the next 12 months, because cranial nerves may regenerate and may be able to gain some function. When all of those things are in place and I understand that as the therapist, I then am moving forward in terms of exercises. So don't hesitate to discuss with your surgeons those patient outcomes so that you can set your patient up for success and stay cohesive with your surgeons and the team from an oncological standpoint.